Sadie Golden.
I'm Julia Young.
And I'm Michelle Candela. We are senior nursing students at Salisbury University, and today I am here to present with you our app, CarbSmart. This is an innovating app that is going to be geared towards clients with diabetes, and this is used to help them better manage their diet. With a show of hands, how many people are either personally impacted or have in their surrounding groups been impacted by diabetes? That's a large majority of the group here. Did you know that over 480,000 people in Maryland are impacted and diagnosed with diabetes? That's a large amount of people. At Title Health PRMC, which is a local hospital here in Salisbury, 40% of the clients being readmitted have a primary diagnosis of diabetes and are coming back with diabetes-related complications, such as infection, coronary diseases, and other specific diagnoses that are related to diabetes. Medical expenses for diabetes related to their complications and medical expenses overall exceed $4.9 billion in Maryland. So you might be thinking, why is diet important? The food that we put into our body is being used for energy, which can lead to weight reduction. When our body's regulating our glucose levels appropriately, diabetic clients are able to better manage their medication, such as insulin, and therefore have a better response to their blood sugar control, which is the ultimate goal for clients with diabetes. And this is how we decrease their complications and therefore decrease readmissions, which is what CarbSmart is working towards. So remember that 40% of clients being readmitted, 42% of clients with diabetes in the studies that we looked at shows that they're not receiving guidance about diabetes self-care, including diet, from their healthcare workers. And about 65% of those clients are also not taking care of their diet on 5 or more times a day. So we see that limited education is being provided and that these clients are not managing their diet.
So because diet adherence is such a problem when it comes to discharge at home, we have come up with a solution called CarbSmart. And this is an app that will include gradual changes in diet plan when it comes to a diabetic diet. It will also include specific meals and recipes for clients that have diabetes when they go home that they can use in order to better manage their diet at home and adhere to it. So it's going to be client specific based on their caloric needs, their comorbidities. As Michelle stated, you can have lots of comorbidities, which is just alternate or other diagnoses that you may have along with your diabetes. And also it will include cultural preferences. So a lot of cultures may have different preferences when it comes to their diet, so it will include all of that. And the big thing with our app is that medical providers will input the client's information into the app to increase the accuracy of the data. So this can include things like age, height and weight, their diabetes type, since there's 2 types of diabetes, type 1 and type 2, their comorbidities, their cultural preferences when it comes to diet, any allergies they may have towards any foods, allergies that they may have, and medications and anything else that might be important when it comes to managing their diet at home. So what it will look like, the education in the hospital is throughout their hospital stay, they will be receiving education about this app and about things that they can do to kind of change their diet, especially if they have a new diagnosis of diabetes. It's especially important because it's a big change in their life. So some of the things that are going to be facilitated with the medical provider is how to create their account, how to kind of use and navigate the app so that they know how to do it at home, how to input like meals and like other information, their glucose, maybe connecting it to their Dexcom at home, and also providing them with a contact or like an IT support for them to be able to use at home if they have more questions. So the annual cost of readmissions within 30 days of discharge is around 20 to 25 billion dollars among patients with diabetes in the US. That's a large amount of money that the hospitals are spending on readmissions for patients with diabetes. So our primary consumer right now is Title Health Peninsula, because we've been looking at what they're doing with diabetes education right now. And obviously the people that will be using the app are patients with diabetes. So our hope is that the patients that use CarbSmart, it will lead to better diet management at home. This will reduce complications and overall reduce the amount of readmissions that are happening. So less money is being spent by hospitals?
So there are many different approaches that you can take when trying to manage diabetes. Right now, Tidal Health uses this little survival guide and booklet that we're going to pass around. The other apps that we found out there was Glucose Buddy and My Diabetes. They are not all free to the client because you have to spend your own money for a subscription plan, where CarbSmart would be more accessible because it's provided by the hospitals. It's not facilitated throughout the stay with the provider with the other apps. This one is going to be directly taught and used for education purposes while in the hospital. There are gradual diet changes between the Glucose Buddy app and CarbSmart, but that's definitely something that needs to be integrated when there's a new diagnosis. They might not know how to start with their diet. All the apps offer glucose, exercise, logging, and then meal tracking. Cultural preferences for diet is included in CarbSmart because there are many cultural preferences that can be taken into account when worrying about diet. And then patient-friendly language at a 6th grade reading level is important so that everybody can understand in these populations what is expected of them.
Hit the space bar. Or the arrows, yeah.
Okay. So for CarbSmart is for local hospitals who want to decrease these hospital readmission rates related to diabetes. It's an app that provides ways for these diabetic clients to manage their condition at home along with a provider. Unlike many of these other apps that are available for diabetes, because they're more targeted towards meals, CarbSmart has more features that's set up by a medical provider, accounts for cultural preferences, and is at no cost for the patient.
So we are so excited for you to get this app into your hands to better manage your client's diet at home and prevent complications and further readmissions to the hospital. I'd like to open up the floor for some questions